Hello, everyone, and welcome to the Advanced Health Care Directives presented by Legal Assistance for Seniors. Right now, you're seeing our welcome screen with some of our upcoming presentations. I will show this slide again at the end in case you've missed any and you want to capture the dates. So I'm going to go ahead and stop sharing my screen so I can introduce our fantastic presenter today. This is Jennifer Pardini joining us from Legal Assistance for Seniors. Truly a wealth of information. And so this is a perfect opportunity. If you do have any questions, make sure you take the time to ask them because we are very lucky to have her with us today.
Thank you so much. This is actually one of my favorite topics to present, so I appreciate you having me. I'm going to go ahead and take it from here. And as Jesse said, if anyone has questions at any point, please just unmute yourself and ask. That's fine. We will be talking about Advance Health Care Directives, but before we do, I'm just going to talk a little bit about the agency I come from. Legal Assistance for Seniors is a nonprofit agency here in Alameda County. We serve older adults. All of our services are free. Everything is age-based, so we don't look at income or assets or anything to provide services. We base everything on age. Our mission is to ensure the independence and dignity of seniors by protecting their legal rights through education, counseling, and advocacy. The areas of law we can help with are government benefits, specifically Social Security, SSI, or the Cash Assistance Program for immigrants. We don't enroll people in the programs, but we're here to help if anyone is in a program and they have any kind of problem. A typical issue there might be receiving a letter from SSI that they've paid you too much and you owe money back. You could come to us for help with that. For senior immigrant issues, we can help to renew a green card. And if someone is a legal permanent resident and they'd like to be a naturalized citizen, we can help with all of that as well. We do elder abuse prevention in that from the community ed department, we come out and do presentations about what is elder abuse, ways to remedy it. And then our attorneys can do things like mediation and helping with restraining orders and getting people connected with the appropriate services to make sure that they're in safe situations. So they walk the client through all the steps of the court and anything else that they need help with. Kin caregiver issues refers to our guardianship program. This is our lowest age threshold. So anyone 50 and over, if they're taking care of someone under the age of 18 and they want to be that person's legal guardian, can come to us for help. We'll help with all the paperwork, the court process, all of that to make sure that they can be the legal guardian for that minor. Planning for the future. So today's topic is about planning for the future. I just like to be clear that our attorneys don't actually do estate planning. So we're not in an estate planning office. We can't help with wills. We don't set up durable power of attorney. I see the question in the chat that is closed caption available. I believe if you wiggle your mouse so that the menu appears, there may be a section at the bottom with like a CC on it. And if that is true, then it should be able to pop up with closed captioning. Jesse, if you're still there and you want to weigh in on that, let me know.
I'm actively looking on my screen and don't see it right now. But I am looking for it. And I do think that it should be on a participant screen where it says CC.
Okay. I think so too. But if anyone can't find that and wants additional help, let us know and we'll try and step in if we can. So just on planning for the future, we don't do estate planning. We don't fill out those documents, but we will talk today about what this document is and how to fill it out if you do want to fill it out. And I recommend everyone fill it out. We also help with healthcare coverage. So I like to say here, the foot in the door is Medicare. And if you don't have Medicare, but you should have it because you qualify or something happened that caused you to not have it anymore, that's a way to get in and get help from us. It can be Medicare and Medi-Cal. We can help with people who have both. We can also help with someone who has Medicare and any other kind of health insurance. It can be retiree coverage, a supplemental plan. It doesn't matter what it is. If the word Medicare is mentioned, you can come and ask us questions and get help. And then we do have a housing department, and that is very small, so it's case by case. We help with a lot of tenant issues right now, things like habitability, unlawful detainers, eviction stuff. If you have a question, please call. And if it's not something that we can help with, we will try to refer to another nonprofit that handles housing. And the person asking for a closed caption is on their phone and asked if that matters. And I don't think it matters. But
I
I
don't
mean,
think so either, but I am on Zoom and checking settings to see if it's something that we have disabled for some reason. And so
okay,
I'll be working on it in the background.
okay, great. Um, The other program here at our office is the HICAP program, and that's Health Insurance Counseling and Advocacy Program. What it means is that we provide objective information about Medicare. So we don't sell any insurance products, but we know all about them. Our job is to answer your questions, to give you information, and that way you can make an informed decision about all of your healthcare. So the services available through HICAP are funded by the Area Agency on Aging. We do have volunteer counselors who do a lot of education on Medicare before they become counselors, and they do continuing education to make sure they're always up to date and very knowledgeable about all things Medicare. We do pre-pandemic counseled at more than 30 locations throughout the county. We're still connected with all those locations, and we have counselors who are mostly counseling by phone still. That's what we switched to when everyone went to sheltering in place, and we haven't quite come fully out of that yet. As some sites have reopened, some counselors are more willing to go back in person and others are waiting. So phone counseling is always available. Some counselors can do things like Zoom and meet with someone that way. And then we do have limited in-person appointments available if someone needs to be seen in person. We do presentations like this so people know their rights and their options. And if it's a difficult case that comes to the counselor, it may then get referred to the legal department for help. If that happens, again, all services are free. So counseling is always free, as well as our legal services. So talking about this document, the Advance Health Care Directive, the big question is, why should I plan now? Like, maybe nothing's going to happen to me and I'll be fine. But in case something does, having this document will help you be prepared for any unexpected occurrence, like an accident or illness. It will ensure that if that time comes, your wishes and your preferences are known and respected, and I would like to add, and followed. And the Advanced Healthcare Directive can help prevent elder abuse, and that is one of the reasons that we offer this presentation. We like to make sure that people know how to keep themselves safe. So planning for the future, it's one of those things where people don't like to think about it because no one wants to think about a time when they're not going to be able to make decisions for themselves or speak for themselves, and that there could be a time where they're going to need help taking care of themselves. But if you do plan for it, then if that time ever comes, you're going to be protected. This is one cover to what an advanced healthcare directive could look like. This one is from the California Medical Association. So there are a lot of kits available. This one is on the resource page we offer. You can order it from them, and it costs, I think, about $5 the last time I checked if you do order it from them. But there are free ones available also, and we'll talk about that. I just use that image to point out one that we talk about. An advanced healthcare directive is a legal document. It makes sure your healthcare wishes are known and considered if you're ever unable to speak for yourself. If you don't have an advanced healthcare directive and something happens to you, your family or friends may have a difficult time helping you if you are unable to express your wishes. So if they don't have it written down somewhere and you've never had a discussion about what you want, then they may be put in a position where they're having to make those decisions and they don't know if they're doing what you would want them to do. Also, if you don't have it written out, it's possible that what your healthcare wish is could not be followed if the person just didn't know and they're just trying to make the best decision in the moment. Also, if there's some sort of long-term incapacity, someone may need to go to court to become your conservator. And we'll talk about what is conservatorship. It's a legal process where the court appoints someone to manage your affairs. The conservator has to keep records and report back to the court. It can be very time-consuming and costly to go through this process. If you have any questions about conservatorship, we don't take conservatorship cases. If someone calls us and says, oh, I'm really worried about mom's capacity at this point. I don't know if she's making great decisions, and I think that I should have conservatorship and be her conservator. So that's a case we don't take. And the reason is that we do sometimes get appointed by the court to represent a potential conservatee. And so there could be a conflict of interest if someone is calling us and saying that they have that concern over another adult. So if you're hearing that and thinking, I do know someone who sounds like maybe that is something that they need, and they don't have all these estate planning documents ready, and they don't have their directive, there is a self-help page on the Alameda County Courts page to get more information about conservatorship. So if anyone does have questions, we just like to say, like, don't call us, but that's one place you can go to get more information. But the whole point of talking about doing these documents is so that you don't get to a point where you have to have a conservatorship. Okay, and Jessie just said it looks like she can't turn the closed captioning on during the meeting, but she'll make sure to have them on in the future. So I'm sorry that we don't have it on right now. It might be something that the recording will be able to add, but I'm not sure. Okay, so this Advanced Healthcare Directive, this is a different version that is also available, and I believe this one is available for free. So this is the Advanced Healthcare Directive kit from this organization, which I cannot see out the bottom because it's not big enough, but what I am going to do is send Jessie a PDF copy of the slides afterwards. So if anyone wants access to these, you'll have what the pictures look like and the information about them. We can send them out to all the participants from today. So an Advanced Healthcare Directive lets you appoint an agent, and it's if you want to. So technically you don't have to appoint an agent, but if you do have an agent, then that's going to be the person that speaks for you if you're not able to do that for yourself. The document lets you put instructions about your healthcare and the choices that you want made. And you can also include things like organ donation, disposition, like all kinds of things we'll talk about as we go through here. Appointing the agent is optional, but there's a lot of great reasons to have an agent, and that includes that they can then make healthcare decisions for you. So if there is a situation that wasn't something you prepared for in the document, the person would be able to make a decision for you as your agent. The idea being that they would make it in the spirit of the other types of decisions that you have in your document. They would be able to make personal care decisions for you. So if there was going to be some sort of long-term incapacity and you're going to need care at home, they can help with setting that up. They can arrange for housing if you're not able to return home immediately and you have to maybe go to long-term care or go to skilled nursing in between that and going home. So anything like that, they'd be able to help with those decisions. They can also help hire in-home help if you're going to need someone to come to the home and help you with certain things. They can open your mail for you, which is a really important legal thing that you're allowing them to do. And if you have not already made a decision about these things, they would be able to make decisions about, pardon me, donating organs, tissue, any other parts, authorizing an autopsy, and any kind of disposition of your remains. So your agent does have to follow your wishes. If you say, I don't want any interventions when the time comes that, I'm going to let that happen, and please don't plug me into all the things. They need to follow that if that's what you wrote out. They can't say, well, I don't want you to go. I want you to stay around. So we're going to plug in all the tubes and keep you here. No, you wrote it in your document. So they are just the voice to put what you want out into the world. Who can you appoint as an agent? Well, almost anyone over the age of 18. It should be someone that does have their own capacity and is able to make legal decisions for themselves. So if that person doesn't have capacity, they couldn't make decisions for you. Also, there's a couple of rules about employees and things that we'll cover here at the bottom, but most importantly, it should be someone that you trust. Someone also who is comfortable with your decisions. So you're trusting this person to be your voice at a time that's going to be very challenging. And you want them to follow, they have to follow what you write, and you want them to be comfortable with that. When my coworker used to do this presentation, she would talk about how her primary agent was her spouse, but her secondary agent, she had two brothers to choose from. Didn't love one any more than the other, loved them equally. But the reason she chose one brother over the other is because she wanted to be cremated, and she knew that the other brother was a bit more traditional and preferred burial, and it would be easier for the less traditional brother to go with the cremation that she was asking for and be in that position to have to make those decisions if that time came. And so I like to use that as an example. Sometimes people have multiple adult children. You can't appoint them all as your agent. It doesn't mean you love one more than the other. It just means that you're choosing someone who you know at that time is going to be able to do what you need them to do and be okay with what you're asking them. You can name an alternate agent. In my document, my spouse is my primary agent, but if we are in a car accident together and we're both incapacitated, someone's going to have to make decisions for me. And so for my alternate agent, I chose my father. I could have also chosen my mother, but again, it's not that I prefer one over the other. It was that I knew that my dad was going to have an easier time having to do what I was asking him to do. How did I know that? Well, as I was filling this out, I called him and said, I'm filling this document out. I want to put you down as my agent. And his first question, of course, in a joking way, was, all right, so when do I pull the plug? And the fact that he could be comfortable asking that and kind of joke about it let me know that I was choosing someone who would be able to do what I was asking him to do if he had to. So you want to talk to the people that you plan to appoint. The craziest thing to me about this whole legal document is that at no point does your agent have to sign anywhere to agree to be your agent. So you can put down anyone you want as your agent, but if you don't talk to them, if they don't know that they are your agent, if they don't know what your decisions are, then they could be really surprised if that time does come. And also they may choose not to step up and do it. So if the primary agent is devastated that you have been in an accident and they're like, I'm just too emotionally compromised, I don't feel like I can make good decisions right now, they can actually pass that along and the alternate agent would be the acting agent. It can't go back and forth. Once the first person is unable to perform the duty, it would go to the second person. So you want to talk to these people to make sure that they're comfortable with being the agent, with the decisions that are in there. And of course, I always like to joke, like, because you could put anyone you want, I could put, Tom Hanks as my agent. But if he gets a phone call and someone says, Jenny was in an accident, he's gonna be like, who are you talking about? Right. So it's really important that whoever you put here is someone that you have a conversation with. So I told you there were a couple of rules, and that is that your agent cannot be an operator or employee of a community care or residential care facility if you're living there and receiving care. If you cannot be your supervising healthcare provider, so like your primary care physician can't be your agent, and it cannot be an employee of a healthcare institution where you're receiving care, unless you are related to that person or you are their coworker. So if you work in this type of facility or location, you have a coworker who you want to be your agent, that would be allowed. Or if it's your, cousin, sibling, it would be fine. But if you are simply a resident, or it's someone who works in a capacity for you and you have no relationship to them, then you would not be able to put them down as your agent. So once you have decided on that and hopefully had a conversation with someone, you're going to get into the portion of the document where you put down what your healthcare wishes are. In this section, you can state your wishes regarding any healthcare decisions so that the person will follow them if you're not able to express yourself. That can include decisions about life-sustaining treatment. So if you choose not to prolong your life, then if you're an organ donor, your agent can consent to temporarily keep you alive so that those organs or tissues can be donated. Meaning, if you have said, I don't want intervention, but I do want my organs to go to as many people as possible because that's what you choose, they may say, okay, we're going to put you on life support just long enough so that they can do those surgeries to harvest those organs and then have them donated. It wouldn't be for the purpose of keeping you alive long term. It would just be to support decisions you've already made. You could also have lots of other very specific choices in there if you have strong feelings about any part of life-sustaining treatment. So CPR, ventilator, dialysis, feeding tube, blood transfusion, surgery, medicine, all these things are listed here below. People have all kinds of different reasons for things that they are, open to or not willing to do. And whatever your reasons are is totally fine. The important thing is that you think about them and put them in the document. Another one of our counselors who I've heard do this presentation, she jokes, but partially jokes. For her, it's the feeding tube. She goes, if I can't eat a steak and a chocolate chip cookie, I don't want to be here, right? Those are her lines. She knows that those are quality of life things, and that if she can't have the quality of life that makes her happy, she doesn't want to be kept around. And so just thinking through what those things are personally for each of us is the important thing to be able to fill out this document and to have your agent know what you want. As far as organ donation, you can put in there if you want to do it, and you can specify which organs. So, some people are willing to donate certain things, but maybe not a specific body part. Like in some cultures, it's the eyes. They're the window to the soul. I don't want anyone to have my eyes. Okay. But some other internal organ, maybe that's fine. So you can be very specific here. You can also specify the purpose. So it could be a donation for transplant. It could be for therapy. It could be for research or education. If you're fine with all of them, you don't need to specify. But if you do have some sort of preference and you don't want to, a piece of your body used for something else, then you can write in there exactly what you're comfortable with, and that will be followed. If you leave the donation section blank, like you don't say absolutely no, I don't want to donate, but you also don't write yes or any of these other specific things. If it's just blank, your agent would be able to make that decision for you. They can also make decisions about autopsy. So you can either write those wishes in, or you can have them decide. And any other specific burial or disposition preference, you're able to put in here so that it's known. I know some people, while I've done this presentation, have mentioned that they'll have already a burial plot or a cremation plan, and they'll keep it with this document just so that if that time comes, everything is together. So it's not something that they do through the document, but they can make it known, and then they keep them together so that it's easy when that time comes. So after you have chosen an agent and filled out your document, you can make this a legal document, either by having it notarized, which you can do, and that's totally fine. It's usually a small cost. A lot of banks offer it. The notary is just looking at your ID to verify that you are who you say you are when you sign the document. So you can pay them, they notarize it, it's a legal document. If you don't want to go through a notary, or you don't want to have to pay for it, you can have 2 witnesses sign. They cannot be your agent or alternate agent. So it can't be the person you're naming in the document to be a decision maker for you. They cannot be your healthcare provider or an employee of yours. And of those 2 witnesses, only one can be related by blood or by marriage. So like I said, I have my spouse and my parent who are my agents. Well, since I chose my dad, but not my mom could have signed as one of my witnesses because we're related by blood, but then my second witness would have to be someone who I am not blood or marriage related to. What we did in our case when we filled ours out was just go to a couple who are family friends of ours, not related by blood or by marriage, and had them sign as our witnesses. So it was easy peasy. They don't have to read, your witnesses don't have to read your document. They don't have to know what's in there. They're not your agent. All they're doing is saying, yes, this person who I know to be the person whose name is on this document filled it out, and I'm signing as their witness that this is them. If someone resides in a nursing home, there's a person called the ombudsman who works with the nursing home and oversees the signing of legal documents. So they would also need to sign it, just verifying that it is in fact the person and their wishes that went into the document. You do not need an attorney to complete an advance healthcare directive. All you need to do is fill it out yourself, and then you can have those 2 witnesses sign it, and it's done. So this is the resource page, and this will be in the handout I send. If anyone has questions about estate planning, you can contact an estate planning attorney. The Alameda County Bar website is there, as well as their phone number. This is the attorney referral information. So all of these attorneys who are listed with the bar have been vetted. You can find an attorney in your area. You would have to call them and shop around for cost to do formal estate planning. If you're just looking to get a hold of the Advance Healthcare Directive kit, the web address and phone number are there for the California Medical Association. Again, it's about a $5 fee for that. A form is available for free through the California Attorney General. The website is there for that. You can also get it for free from a lot of healthcare providers. I know specifically that Kaiser has a document that they offer to members, but although you don't have to be a member to use their document, if you happen to get a hold of the Kaiser one, it's valid in the state of California. And so you could use theirs, fill it out, and give it to your primary care provider, even if they're outside of Kaiser. Kaiser has done a big push to get their members to fill these out and to have them on file. So that's why they have it available. You do have to fill it out and actually physically either mail it in or turn it in to the member services department so that they can scan it. And that's because they have to have that signature on there. So they can't just have you fill it out online. But if you do that, they scan it, it's in your file, you show up in an emergency room, everything's there and easy to pull up. And they've really wanted to push for that so that people are set up to have good decision making in an emergency or in sudden illness. So your healthcare provider may offer one. There's another one that does cost a fee available through an organization called 5 Wishes, like the number 5, and then Wishes. It's very thoughtful in the way that it asks questions. So I will say that the California Medical Association one is much more cut and dry. It's like, do you want to donate organs? Yes or no. Do you want life-sustaining treatment? Yes or no. Now you have areas where you can write in and be more specific about any of these things. And you can always add as much as you want. You can add, there's in the California Medical Association one, there's a one blank page at the back where you can write out all of the things that are important to you about any decision being made. And if you run out of room, you can add as much paper as you need into the document. If you want to be specific about any possible situations that could occur, you can put that all in there and it'll be in there. The difference between that and 5 Wishes is that 5 Wishes asks questions that are much more value-based, like what is quality of life for you? What do you want to be able to do? If you needed support to do certain things, like what kind of support do you want? And so it is a very nice one. And it's also available in many languages. If you go to the 5 Wishes website, they have a drop-down menu of like 30 or more languages you can choose to do your document. If you do it in another language, you do need an English version available for your provider, because anyone who may need to access it at the hospital or in the medical field would want to be able to read that. But a lot of people like the idea of filling it out in a language that they're more comfortable in, if that's not English, because there's so much nuance and value based to it that you can really think through it and then you can put it into English and have that available. Once it's completed, keep the original in a safe place where it can be found, right? You don't want to fill it out, stick it in a drawer, and nobody knows where it is, so it's not going to get followed. We recommend giving copies to the people that you're appointing as your agent, giving a copy to your doctor, and then any other family member who could be called in an emergency. So even if it's not the person you've listed as your agent, if your sister or one of your children is going to be close and gets called if there's an emergency, you want them to have a copy so that they can hand it over to the hospital and make sure that they know who to contact as the agent. You can revoke or change it at any time. I always like to say I don't love the idea of revoking, because then you have nothing. So if you want to change it or update it, that's fine. That's a great idea. There are some really good times to do that. We would say check your document at least once a decade, because things can change. If there's a divorce or a death, and maybe your agent's not the person that you would want anymore, make sure you're updating your document. If there's some sort of diagnosis that you've gotten and it's changed your opinion about the kind of care you want, that's a good time to update your document. So just being thoughtful to make sure that it is current and up to date for your wishes as things change over time. And often they'll have a little wallet card. So once you filled it out, it's a little punch out card you can stick in your wallet. It's going to have your name, any emergency information, and then also the name of your agent that you would want contacted if you were brought in an emergency. We're going to talk real quickly about this other document called the POLST, Physician Order for Life-Sustaining Treatment. It is similar to an Advance Health Care Directive in that it lays out medical decisions. It's completed between you and your physician. It will reflect on your preferences for any kind of end-of-life treatment. And once it's signed by your doctor, it is considered valid medical orders. So if that were in your file and you came in an emergency, they're going to pull that up, and anything that you and your doctor decided that you wanted as far as medical intervention will be followed by that emergency personnel. To complete the POLST, you want to discuss with your doctor your values and wishes for any kind of end-of-life treatment. Medicare actually pays for this appointment. So you can schedule an appointment with your physician for end-of-life planning, and Medicare will pay that physician to have that time and that discussion with you. At that point, the physician can complete the document based on what you've decided. They'll sign it, and you or your legally recognized healthcare decision maker can also sign the document. So if you have capacity and there's no issue, you can sign it. If you have someone who's already acting as your agent and they're filling this out with your doctor, you're going to have those conversations. The doctor is going to write it out and then they could sign on your behalf. There's no witness necessary for this one because it is standing physician's orders. It's only the physician that needs to sign that. It will specify any preferences you have regarding resuscitation, commonly known as CPR or DNR, right? Either if you have collapsed for some reason and the emergency personnel shows up, either you want them to try and perform CPR, or you've made a decision that you don't want intervention and you're going to be DNR, do not resuscitate. You can also put in any range of medical information interventions that you are comfortable with. So that could be any kind of comfort care. Again, any of those things we talked about before, like intubation, ventilation, and then also the artificially administered nutrition known as the feeding tube. So you can put all of those things into the POLST with your doctor as standing physician's orders. The POLST and the Advance Health Care Directive document are different. The POLST is a complement to the Advance Health Care Directive. So it converts those healthcare wishes that you've named into valid physician's orders, but it doesn't appoint the agent. And the Advance Health Care Directive does allow you to identify that person who will be your decision maker, which is important if there's anything that's outside of those medical orders that wouldn't be something that your physician would decide for you. So this is also going to be on the deck. It's the information for our office and the information for the California Medical Association. Again, if you want to go with their kit. And if you'd like an appointment with any of our counselors to talk about Medicare, or if you have a legal issue like anything I mentioned before and you want to talk to one of our attorneys, you can call our office. I am going to talk real quickly about one other thing. I knew I had one here. So this isn't the Advanced Directive. It's actually called a Vial of Life. This one is available through the Alameda County. So it's www.acgov.org and then /fire. So this is the county fire department, not a specific city fire department. That I got this one from. And they should have more. So if someone wanted to contact them and ask for it, you can just reach out to them. The phone number is also on here. It's either 925-833-3473 or 510-632-3473. So you can call them and ask. They should be able to get it to you.
Jenny,
yes.
Can you repeat those one more time?
Yes, it is 925-833-3473.
Okay.
Or 510-632-3473. So I'm trying to, I can't tell if I'm holding it into the camera, but I'm trying.
You are.
Okay. So why am I talking about this? Because it tells emergency personnel your medical wishes if they have to come in, like you've collapsed and 911 gets called. So there are 2 stickers in the kit. One sticker goes at your front door. This alerts emergency personnel that you have this so that when they get into the house, they're going to look for it. They're going to look for it on either your freezer or refrigerator. So if you're going to put it in the freezer, stick the second sticker on the freezer door. If it's going to be in the fridge, stick it on the refrigerator door. They're going to look for, if you have this one, they're going to look for this. If they don't see this or, something that says Vial of Life immediately, they're going to probably be looking for like a little bag. That's how my grandparents had theirs, is a little bag on their fridge. And so they're going to be looking for something that alerts them to information. So what is in mine is a little paper that has name, address, date of birth, doctor information, hospital preference, my emergency contact information. And then on the back, if I'm allergic to any medication, current medications I'm taking. Now, if my wife had to fill this out. Her current medications are not going to fit in that tiny spot. So you can always, if you've got a lot of medications, just print that, fold it up and stick it in here with this. Do you have a pacemaker, any medical history like high blood pressure, lung problems, asthma, right? All kinds of things on here. Any additional information that you want to provide can also go on here. If I am do not resuscitate. If I'm like, hey, look, I'm sick, and when things happen, they're going to happen, and that's what I want, I'm going to put big DNRs like all over this. I'm going to have it on this side and this side, because emergency personnel's job is to save you. When they come in, they're going to try and do everything that they can. And so if I can tell them, hey, I don't want that, then they're going to know, and they're going to have it documented. So they're not, going to have any issues for the fact that they didn't try because that's what I wanted. So this is a great little thing you can have. Emergency personnel is trained to look for it. They're gonna, if they see that sticker, they're gonna look for that, and they're gonna try and find exactly what you want. And again, if you have a lot of medications, just stick an additional form in there. You can put the whole thing in. Pop this little thing in your fridge, or your freezer. No, don't put it it's not a treasure hunt. Don't put it somewhere else in the house. It needs to go in one of those 2 locations, because that's where they're trained to look. But it is going to be really helpful, because they're not going to go looking for someone's advanced healthcare directive when they come in an emergency. But this is a great way to alert them to any information that might be really helpful. And if you do need to be saved, right? Because medications can interact with each other. And if you do want CPR, or you are taking something, you want to give them that information. So I like to promote that, even though it's not technically the directive. Thank you for putting the numbers and the link in there. I think this is the last of the slides. I'm going to hit the button and see. Yeah, it is. So that's the last of the slides. I'm going to stop sharing my screen so I can see people again. Now I can see. If anyone needed me to go back to anything, I'm happy to share it again and go back to a different slide. But I'm here to answer. We have 15 more minutes. Answer any questions that you may have. And if you have none, that's okay too. Or if you think of them later, you can always reach out.
Does anyone have any initial questions? All right, well, I'm going to go ahead and stop the recording.